Thank you so much, Pascal. Yes, my name's Katie Walker, and my topic, thank you so much for coming today to listen to my topic. And it's Hidden Doubles in Healthcare, Developing a Deeper Understanding of Learning Practices that Optimise Dyad Performance in Complex Situations. And I must give a really big thank you to my mentors, professors, supervisors. Assistant Professor Mariam Asuda, thank you so much. And of course, Professor Jeroen van Marienboer. Thank you so much. You've really guided me along this journey so far, and I'm really grateful to you for that. Okay, so as Pascal said, I'm the director of the New York City Health and Hospitals Simulation Program. New York City Health and Hospitals is the largest public hospital system in the United States. And so our simulation program caters for 42,000 staff who work in that hospital system. And so we think really deeply about learning practices, and I report directly to the Chief Medical Officer, and so our simulation program is really geared towards solving problems within our hospital system and really improving the care of patients. One of the big issues that we're dealing with at the moment is maternal mortality, particularly among women of colour in New York, because it is a really, the statistics are not good. The simulation program has received a grant from both the city and the state to develop a large simulation program to deal with that. But before we actually started running our simulations, a woman came into one of our facilities, into the labour and delivery. She started deteriorating very quickly. She was rushed to the OR, and unfortunately there was some communication and coordination problems within the OR, particularly between the anaesthesiology team and the surgeon, and unfortunately the woman passed away. This was a really, really sad occurrence obviously for the family, but also for all the staff that worked in that area, and for the system as a whole. So as a simulation program, we wanted to think really deeply about what is it that caused that to happen? How could that happen when these people are just such professionals? And here, we know that operations happen every day. What is it? What are the learning practices that some clinicians do that make them experts? And so when they're in a very difficult situation, they're able to deal with it, and others not. And then, as a source of inspiration, started to look outside of healthcare and try and think, what's an expert group that is a doubles group that is under, has difficult situations to deal with, but performs really, really well. And this is a picture of the Bryan brothers, and they've won many Grand Slam tournaments. And when they're working together, it's almost like they're dancing. Their communication and coordination is just so good. And what is it that actually, what are the learning practices that they've done that actually makes that happen? So here is my theoretical framework. And this, as I've said previously, we know that the individual of an anaesthesiologist and a surgeon are expert, but what makes them experts together? So to think about that, I looked at the theories of distributed cognition and relational coordination. And as you can see, the elements there are a lot that are quite similar. And the idea here is that to have an excellent dyad performance, that each member of the dyad would participate together in the elements of distributed cognition and relational coordination. This would mean then that they would be able to manage their cognitive load efficiently, and their performance would be excellent. And then just mapping these theories against each other. So you can see again that there's similar elements in distributed cognition and relational coordination. There's two pieces that stand out. So there's alert reporting in distributed cognition, which isn't in relational coordination. And there's mutual respect in relational coordination that doesn't appear in the distributed cognition literature, and it'll be interesting to research this further. And then the idea is that if these elements, if the dyad's working well and all these elements are coming together, that the cognitive load would generally be low. However, when they're faced with a really difficult situation and they're problem solving, that would raise their cognitive load. However, they would be able to manage it effectively because they would have enough working memory there. So, what is the problem? The problem is suboptimal performance of healthcare dyads. And so the goal is to develop an assessment tool to review dyad performance in the operating room between a surgeon and an anesthesiologist, and it will include a planning tool to guide learning activities for improvement. And so now to the studies. So there's actually 5 studies. The first study will be a literature review. And so there I want to look at both sports dyads and healthcare dyads and understand what are the learning practices used by dyads that lead to optimal performance in complex situations. The second study will be a very large questionnaire. So when you're an expert in a field, you definitely know who the other experts are in that field. And so when we are considering expert surgeons and anesthesiologist dyads and elite sports doubles players, what are the learning practices that other experts in their field consider are essential for excellent performance? So basically asking other experts what they feel the learning practices are that led to that expertise. And then study number 3. Here we will use a simulation environment for an operating room and a practice court for the sports doubles players, and we'll put the scenario will be complex for the operating room dyad and complex for the sports players, and then we'll debrief them after that scenario, and we'll get them to actually reflect on what they think the learning activities were, that learning practices that led them to either performing well or maybe where their weaknesses are not so well. And that's where we actually leave the sports dyads. So hopefully from the sports area we would have got some inspiration or some thoughts from there. And then we move on to study number 4, which is actually a design study, and this is where we will actually develop. Maybe will be an app or on an e-learning platform, and it will be an assessment and planning portfolio that would assist dyads to assess where they are currently, identify their strengths and weaknesses, and plan learning activities to work on their weaknesses. And that's where the deliberate practice piece comes in. And then study number 5 is implementation. And so here we will actually probably follow a dyad for a year, or not one, many dyads for a year. And they'll be using the tool, and we'll look at the dimensions of usability and really be able to see, does the e-tool work for them? Are they able to assess where they're at, and are they able to learn planning activities, and have they actually got better? Have they really gained in expertise in terms of how they work together? And as Leo Buscaglia says, change is the end result of all true learning. So, my real goal, desire with this is to just be one more little piece in improving patient safety in our health systems. Thank you.